Practical Nursing Jackson College students. My name is Darlene Lepresto and I'm a nursing instructor here at the college. Today we're going to do a complex sterile wound dressing with irrigation. First, I want to show you a couple of drains. When you watched your simple dressing change video, you saw that we had a Penrose drain in our client. We also have a couple of other drains that your book talks about, so please be sure that you take a look at these. The first one is called a Hemovac. And the Hemovac and the Jackson Pratt drain are both used, or they perform by using negative suction. So the physician will place these in surgery, and it's our job as nurses to monitor the output of these. Now, when you're handling these, of course, you're going to have gloves on. Be very careful when you're opening the spout, because if it has any fluid in it at all, it will spray you. So be careful. But to open them, you open the spout with gloves on, and then we would have a small urine container and pour it in and measure it, and then that's part of your output. And then to reactivate this, again, you have to be really careful because it has fluid in it. I take it with both palms in my hands and I squeeze it down, and then I push the plug in. And you want to make sure, and I'm going to clamp it so it stays that way, you want to make sure that it stays compressed, because that's what's causing the negative pressure within the body, and then slowly, as that fills up, the diaphragm will open up. And then when the physician determines, then that will be removed. Alright, so that's a Hemovac. You just have to be brave and touch one when you have one in a patient. This one is the Jackson Pratt, and it's a bulb. Works the very same way. It has a spout on the end, and that's where we would open it. So say this one is full, because it's fully extended right now, so it's full of serosanguinous drainage. We're going to slowly open the cap. We're going to pour it into a measuring cup, note all the characteristics of the fluid, discard that, include it in your output, and then to re-engage this one, you have to compress it with your palm of your hand. And just again, be really careful because you don't want to squirt fluid all over. All right, and then it will stay compressed like that, and then it's attached to the patient. So just lay it at the side, or sometimes we pin it to their gown so that it doesn't get pulled off or out of the patient, and then slowly that will expand again as it's filling up with fluid, and then you just keep emptying it. And then again, the physician is the one that determines how long those are in. So those are some drains. All right, we're going to start our dressing change. So, knock, knock, knock. Hello, Mr. Jones. My name is Darlene Lepresto. I'm a nursing instructor at Jackson College. I am here to change the dressing on your abdomen, and we need to irrigate that wound today. The doctor's coming in a little bit, and he wants to have that done before he gets here. So before I do that, can you tell me, are you having any pain right now? No pain right now? Okay, good. All right. I'm going to take a look at your armband, so give me your name and date of birth, please. All right. And any allergies to any medications? No? Okay. Very good. I'm going to get you ready. I've got my supplies here on the table, and I'm going to lift you up a little bit here so it's a little more comfortable for you and me. Now for this procedure, you're going to want to use a bath blanket, just again to maintain some privacy. We could have done that with the simple dressing change that we did as well. You're going to expose the abdomen. And now with him, we're anticipating part of the order is that we have to irrigate the wound. So normally I would roll him on his side towards me, but you won't be able to see that. So I'm going to roll him on his side toward the camera, but just so you know, normally I would be on that side of the bed doing my nursing care. I'm not going to be reaching across the patient. But for the sake of this video, that's exactly what we're going to do. So I have my pillow here. And why we want to roll Mr. Jones over just a little bit is because we don't want, when we irrigate, we don't want him wearing it all. We don't want to contaminate his bed. How does that look? Good visual? Okay. All right. So I've got him on his side, and again, bad body mechanics because I'm reaching over. But I would normally be on that side with you. So we're going to expose the area, try to maintain some dignity here as well, privacy. Looks like we've got quite a bit of drainage today on your dressing, Mr. Jones. Now, Mr. Jones, I put a blue pad here to kind of help with my working area to keep his linens clean. I already have a blue pad on the bottom of his bed as well, so that will catch any of the drainage in case I'm a little sloppy with his irrigation. Okay, hand hygiene, before and after, every time you put gloves on. Now, you can do this a couple of ways. You can go ahead and take the dressing off and then get your irrigation ready, or you can get your irrigation ready now and then take the dressing off. So I'm going to get, because there's nothing sterile with what we're doing right now, I'm going to get our bag, our biohazard bag ready. Mr. Jones, I'm going to use you as my table again. So I'm going to go ahead and get my working area up here close. And I'm going to put the call light on for my, well, I guess I'll use this. I was going to get a kidney basin, but I don't really need one because I've got a basin in here. This is an irrigation tray with a piston syringe. You'll see these a lot in the hospital. They're used for lots of different kinds of irrigations, Foley catheters, wounds, lots of different things. So this drape is considered sterile, but an irrigation is not really a sterile technique. We do it with regular gloves. We just want to keep the saline as sterile as possible. Now, do you have to worry about that 1-inch border again? Yes, you do. If I wanted to, I could use this whole area as my sterile field and drop dressings on it, but I really don't need to do that right now, so I'm not going to do that. Okay. Now, this has an irrigation piston syringe in it, and I can touch the outside of that, and then it has a drape in it, just in case we need it, but we don't really need it. So I'm going to use this tray to irrigate in, and I'm going to use this with my saline. So what do we do with our saline? We always check to see what the date is, if it's been expired, if it appears clear, that is 0.9% normal saline, and this was opened yesterday afternoon, so it's still within the 24 hours, so it's still good for us to use. I'm going to open this, I'm going to lip it like we did before. I'm going to walk around and you might not see me, but you know I'm lipping it into the biohazard bag. So we always lip it first, and then I'm going to come back, I'm going to pour some in my irrigation container. And then I'm going to put that off to the side. All right, so hand hygiene before I put some gloves back on. Let's put our gloves on, and we're going to take that dressing off. And now notice we have got a lot of drainage here, so when we are all done with this procedure, we're going to document extensively the serosanguinous drainage that this client has. Again, when you remove the tape, hold the skin down and pull the tape up so that you're not going to create a skin tear. And again, I'm doing bad body mechanics because I'm leaning across the client. I would not normally be doing that. I would be on that side. All right, so we've got actually some sanguinous drainage too. It looks quite red. So we're going to have to be sure that we document that. All right, I'm going to carefully remove. And if this sticks, because it might have dried out a little bit, we could always wet it with a little saline, because you don't want it to pull the good epithelial cells out of the wound bed, and you don't want to cause your patient any pain. So that looks pretty good. And I'm just going to do that. Hand hygiene. All right, so we need to irrigate, and then we're going to measure. And you know what, my trusty assistant, I need a measuring tool, please. I have a charge nurse who's very good about walking by and checks on me, and she's going to get me a measuring tool. It can be just a paper tape would be great. All right, so now the same rules apply as we do with all plungers. We want to try to keep the inside of the plunger sterile, because that's touching our sterile saline. So we're going to go ahead and draw up some saline. Try not to touch the plunger. Kind of hard if you have short hands. And take your tray and lay it right here, because gravity, it's going to run down, and we're going to start at the top and we're going to irrigate down. So cleanest to dirtiest. So irrigate, irrigate, slow, irrigate, slow. Keep your tip about 1 inch away from the wound. Irrigate, irrigate. Good. We're going to do that one more time. Thank you. My supervisor, you can just lay it anywhere you want. Thank you. Okay. Again, cleanest to dirtiest, top to bottom, about 1 inch away. Nice steady stream. It's easier when there's really saline in there. Good. That's run clear. All right, so. Okay. Miss Assistant, will you come do one more thing for me, please?
Certainly.
Thank you. I don't have to stay sterile, but will you just open a 4x4 for me? Now, I'm not sterile, so I could do that myself, but since I have a nice assistant, I'm going to just have to do it for me, because you can see how, aren't those
Yes,
are the
stinkers.
terrible dressings. But that's how nurses help each other when they want to stay sterile and you want to open another container, because it's like, oh my gosh, I think I need more dressings. You just have someone come and they'll open it up for you, and you can pick it right out of the container, and you're still sterile. So I'm just going to just kind of dry that, pat that dry, top to bottom one time, and then I'm done. All right, so now we're done with the irrigation portion. So I'm going to measure. And again, we're going to measure according to what they were measuring already for consistency. So the first thing that we're going to do is we're going to do it in centimeters again. So top to bottom. So 10 plus 3. So 13 centimeters long. Let's do the width at the widest part too. 2 centimeters width. And then I'm going to take one of these Q-tips, because again, I'm not sterile. And I'm going to measure the depth of it. Now I'm not going to touch the bottom of the Q-tip where the spongy part is. I'm just going to gently insert where it looks like it's the deepest. Put my thumb right there so I can not throw that away. Measure 1 centimeter. So 1 centimeter in depth. So you have to remember all of those measurements, because at the end of this procedure, we got to document all of that stuff. All right. Now, gloves are off. What do we do again? That's right, hand hygiene. Again. Now I'm going to get my sterile field ready, and we're going to get this dressing packed before the physician gets here. So, we need our fluffs, because that's what we're going to wet, moisten with our saline. I've got my sterile gloves. I've got my ABD. I've got some 4x4s. They did have 4x4s on it before, so I will open a couple of those, and then I'm going to save one in case I need one. My assistant will do it, and then I've got my Q-tips. Now, just like we did with the simple dressing change, I'm going to put those Q-tips I am going to open those up a little bit, and I'm going to tape those to my tray because I don't have a lot of room on my tray for dressings. It's kind of crowded. And then that just is really a nice, easy way to grab a hold of that. Remember, those are sterile, so we have to be careful with that. All right. So again, we have to check our saline, check the date. There's no sediment in it. You always open your trays away from you. Palm it. I'm going to reach around my sterile. I'm going to lip it. And then I'm going to pour it on here. And I'm just going to pretend for this one. Pour it on there. Okay. Now I'm going to open a couple of 4x4s, hopefully. These are the worst. You know, there's no need to rush. You are in no hurry when you're doing these skills. So just take your time, think things through, talk to the instructor, let her know what you're thinking. Because if we know, then we feel more confident that you understand why you're doing it this way. So I'm trying to maintain sterility here. Don't want to reach across. Stay. I think those will be enough. I have one just in case. And that is real life. All right. Wash those Q-tips. There we go. Okay. Mr. Jones, how are you doing? Are you getting more painful? Okay. All right. I'm getting moving here so we can get you done. Now, you've already seen me do the sterile gloving in person and on the other video, so I'm going to just go ahead and do my sterile gloving over here on the table. But as you're watching me do this, just remember what concepts you should be thinking about, that you have this 1-inch border. Don't let them flop off the table. Dominant hand goes in first. That might be a little tricky. Okay, I can't fix that right now, but I will in just a minute. I can touch 1 inch, so I'm going to bring that back. I'm going to get underneath that cuff. Hitchhiker thumb, keep that out of the way. Okay, now I can touch that, right, because I'm sterile. I just got to figure out which finger goes in there. Goodness gracious. There we go. All right, and I'm not going to worry about the wrist. Don't care. I want to stay sterile. All right, I'm just going to touch the center of that because it's sterile and just get it out of my way. All right, so I've got my saline Curlexes all wet and ready to go. Everything's open and ready to go. And I'm sterile. So I'm going to take my Curlex fluff. I'm going to wring it out. And then I'm going to kind of make it into a rope, because I need to put it inside that wound. And I don't want to pack the wound too tight, because then the epithelial cells won't have room to grow, because they build a bridge off of each other. So kind of make it a rope in your hand, because you have to control this. It's a sterile dressing. And I'm kind of twisting it as I'm rolling it. And I'm putting it in my left hand because I'm right hand dominant. I'm going to take my sterile Q-tip. And we're going to start at the top and work our way to the bottom. And the goal is to keep that dressing in the wound bed. You don't want to drag it along the sides of the wound as best you can. And again, it's a little easier when these dressings are wet. So if I go outside of this wound a little bit, it's because the dressing's not as pliable as it would be. So I'm shoving it in there. But it would be much more compliant with what I wanted it to do if it was wet. But if, say that it was wet and it dragged over the edge, I wouldn't push it back into the wound because then I've contaminated my wound. Okay, so now I'm all packed, it looks good. I'm gonna get rid of my Q-tip. And as I'm packing this, I'm noticing that this wound has some erythema around the edges. The edges aren't macerated, which means they're not white. Doesn't look like you just got out of a bathtub. But it does have some erythema around it. I don't see any signs and symptoms of infection, but I do want to note that when I do my overall charting at the end. All right, let's get these 4x4s on here. So cleanest to dirtiest, top to bottom. All right, and I didn't need my other pack, which is fine. Sometimes if they have copious amounts, you might want to use it. Now my ABD, again, remember to grab it right in the middle to control it. And then unfold it. And the bottom is sterile. The bottom is sterile. So he has a vertical dressing, so I'm going to go straight down. Just like that. Okay. Now I'm good. Everything underneath is sterile. On top, I don't have to be sterile anymore. I'm going to take my gloves off. Hand hygiene. And then we're going to tape that. We're going to date it, time it, and initial it so that the next staff knows. We're going to reassess for pain. We're going to see if he needs to potty or any of those other patient needs. We're going to put him down, his bed down to where it should be. As far as safety measures, call light within reach. What else can you think of that I haven't? Bedside table next to him so he can reach his water and urinal. Be sure to tab the ends of these. Which I'll go back and do. And then we'll reposition him for comfort, because we don't want to leave that pillow underneath them. And then I went back and I tabbed all of those, so we are good. Let's move our tray away so we can get him comfortable. Hand hygiene, just because I touched that blue pad, makes me feel better. All right, Mr. Jones, let's move this pillow out. There you go. Okay. Do you need anything for pain? Oh, you just want to rest for a while? Okay. I don't blame you. All right, and that concludes this video. Thank you.